Okay. Today we are welcoming 3 scholars who will share their perspectives on how to engage in meaningful and relevant research during the COVID-19 pandemic. But before we get started with our workshop, I'm going to turn over to one of our graduate students, Talia Barras. She'll give a short introduction to the workshop and also introduce our first speaker. So take it away, Talia.
Thank you, Meredith, Dr. Rafe Schneider. It's been a pleasure planning this with you. And just very short, the goal of our webinar is to discuss strategies for navigating fieldwork during the COVID-19 pandemic. Hopefully together we can make a plan of action and do activist-oriented work despite the current limitations. So our first speaker is renowned sociologist, Dr. Deborah Lupton, who is a Sharp Professor in Media, Sociology and Cultural Studies at the University of New South Wales in Sydney, Australia. She leads the Vitalities Lab and the Center of Excellence for Automated Decision-Making in Society. She's been a leader in the field of sociocultural medicine and public health, and more recently has pioneered the study of digital sociology. Dr. Lupton has written about parenting culture, the body, risk, obesity politics, HIV/AIDS, and emotions. These topics inform her most recent research on big data cultures, digital food cultures, and the sociology of self-tracking. She has authored 15 books and over 150 peer-reviewed articles. Dr. Lupton's most recent book is entitled Data Selves from 2019, and this year she published a reference document entitled Doing Fieldwork in a Pandemic. Her very interesting blog is called This Sociological Life. Dr. Lupton, thank you for being here.
Hi, thank you. Thanks for inviting me to speak at your event here, and yes, beaming in from Australia. So yes, I've called my talk, and I understand I've got 15 minutes, right? So right. I'll keep it to the 15.
I'll give you a thing.
I've called my talk Researching Post-COVID Worlds, and this is, as someone who has been around in the research world for a few decades now, it was really, and also I was around when HIV/AIDS, actually I was very early career research. I did my PhD on HIV/AIDS in the 90s, and when COVID started to become obviously the major pandemic that people have been warning us about for quite a long time that would erupt and affect the world, became obvious once, I guess, it was declared a pandemic by the World Health Organization, March 11, 2020. And very soon after that, countries began reacting. My country certainly reacted very quickly with closing international borders and putting into place lockdown restrictions and shutting down businesses and schools and universities and so on. It became obvious to me as a social researcher who has researched pandemics before that we will need to think very carefully about what we're going to research, not only how we're going to research, but what we are going to research. So I started writing about this, publishing some blog posts, and I did put together the document that was just referred to that I'll talk a bit more about in a moment. But really the problem for many of us, and certainly for myself, was you plan to conduct field work using traditional face-to-face methods, and then COVID-19 erupted. Now what? And I was in the middle actually of field work in Sydney, which involved a very face-to-face method. It was a digital ethnography where we went to people's houses and videoed them as they did home tours of their houses. We were interested in the digital technologies they used in the home, and also the digital data that were generated by those technologies when the families were using them. And we wanted to talk to people about those technologies and data. So we went to their homes, we got them to show us the technologies in place in the home and what rooms they were located. And we had just started that project in February this year, early February, and then of course March was then late March in Australia was when the government advised us we could no longer go to other people's households for social encounters and of course for research encounters. So we had to think very quickly about how we would turn this fieldwork into a virtual fieldwork approach. That's the time, around that time was when I started the Google Doc, doing fieldwork in a pandemic. And later on, I also started to generate this resource I call Breaking Methods, which are short form YouTube webinar series about innovative methods, because I'm very interested in innovative methods, which includes not just digital, but also very non-digital hands-on methods. And I'll talk a bit more about those a bit later in the talk. So these were two resources that I got going. The doing fieldwork in a pandemic was the first one. I have quite a lot of Twitter followers, almost 12,000 now, I think. And so that was a really great network for me to just tweet out. I just made the Google Doc. I put a bit of content in it based on my own knowledge of how we could do sort of remote fieldwork methods in this situation where we could no longer be in the same room with people that we were researching. So I started it off and then I tweeted about it. I've got a Facebook group that I was managing on innovative research methods. So I also shared the document with that group. And people were really responsive. It was fantastic. People responded really quickly and started entering content into this crowdsourced document. I kept it open for a while, and made sure I, regularly checked it, made sure that content was appropriate, sort of put titles in, title page, and so on. And yeah, just kept an overview of it, an editing role on it, the Breaking Methods YouTube series came a bit later. When it became obvious to me, and I have a little postdoc team in my Vitalities lab at the university that I'm at, UNSW Sydney, and we could see that people were now doing a lot of teaching online. So because we are interested in innovative methods, we thought that was another resource we could start offering. So we've made little webinars, voiceover webinars, and we've presented them on that YouTube webinar series for anyone to use in teaching and for students to use as well for their own interest. So looking at the types of methods that were uploaded, the content that was uploaded to the Google Doc on doing fieldwork in a pandemic, there's basically two main types. There's the traditional face-to-face methods that needed to be transformed into distance methods, but then there's the born digital methods. So these were already at a distance. That was sort of scraping data from social media, for example, or looking at YouTube videos that had already been made by people as a form of research materials. And this is just, you can easily Google doing fieldwork in a pandemic if you're interested in actually looking at the document. It's almost 40 pages long now. I did close it a while ago because it was, we already had a lot of content in it and I didn't want to spend too much time sort of keeping an eye on it and editing it. So I did close off. So you can't actually contribute to it anymore, but it is there as a resource that you can actually look at. You can actually print it off as a PDF if you're interested, or you can link it to your websites, which a lot of people have done, I've noticed. And I've just put the table of contents in there, which when you go onto the document, you can click on each one of them and go straight to that content. And as you can see, there is a very diverse group of methods there. Just going to the next screen, that's the second part of that list of methods. So they range from sort of time-honoured approaches, telephone interviews have been around for a long time as a distance research method, online forums, online surveys have been around for a long time, but there's actually quite a few new ways suggested of doing online research or virtual research. There's also a link to sort of another group of resources. So for example, the LSE Digital Ethnography Collective Reading List was a Google Doc that had already been put together by other colleagues at LSE. And if you click on that, you will see a lot of resources there just in that list alone. I do want to emphasize, though, that it's not all about the digital. And even though I'm a digital sociologist and I've been researching people's use of digital technologies since the 1990s when personal computers first became popular, I am interested, as I mentioned earlier, about hands-on pen and paper methods as well. And I actually don't do, and I hadn't previously, and I still don't do a lot of digital data scraping and that kind of research. I'm not that kind of researcher. I am interested in using methods to talk to people about, or to record people or in some way get some sense of how people are using digital technologies, but that's different from using digital data to understand their digital practices. So there's actually two different ways. It gets back to the difference between turning your field work that used to be face-to-face into digital methods that might involve just using a platform like Zoom to do in real-time interviews and get people to show them around your house, which is what we ended up doing with our field work. That's how we turned it into a virtual ethnography in a fairly simple way. But I'd like to emphasize that, you know, we don't necessarily need to talk always about using digital technologies to do fieldwork, even when we still can't sit down with people and talk to them or observe them in face-to-face approaches. We can use pen and paper diaries, drawings, handwritten creative responses, mapping exercises, collages, letters, cultural probes. You can actually drop them off to people. You can send them in the snail mail. They can send them back to you in the snail mail. They can take photos of what they've done and email them to you. There's lots of different ways you can actually work around these hands-on methods that are still done remotely, because people might do them at home when you're not there, but they can be done in an analog rather than a digital approach. So I'm just going to finish with some just examples of these kinds of hands-on pen and paper basically approaches as mapping. That's some people mapping. And again, you can do this online with an online discussion group if you can't do it face-to-face. But you can still have people working with pen and paper and talking about what they've done. And for me, the great richness of these kinds of hands-on creative approaches is really not so much the process of creating these artifacts, but people being able to talk about what they've done and getting them to explain why they made the choices they did in creating these artifacts. I find that's where that can be a really generative way of doing social research. So this was a mapping project looking at digital health technologies and the way that people and digital health technologies are part of networks. Storyboarding is also a method I've used. It's where you, a bit like the approach used in making films, where people tell a little story with words and images. This was about a new digital health technology that someone had imagined, and they were just putting it into context of somebody's life. Zine making is an approach we've been experimenting with in my Vitalities lab. Zines are little amateur-made, do-it-yourself magazines, and we did an algorithmic decision-making and micropolitics zine making workshop in pre-COVID times. But again, I've participated in an online zine making workshop, which can be just as much fun. And this is just an example of the pages of the zine that were made, and they're then collated and can be published online as a PDF. Creative writing prompts I've been experimenting with as well, just giving prompts for people to again write down using handwriting, but they can be done online using SurveyMonkey, for example, as well. And I have experimented with that as well. And just as a final issue, don't forget the ethical implications. So what we had to do when we turned our in-person fieldwork visiting people's homes that we had already got, of course, ethical approval from our institutions. When we decided to turn it into a virtual approach using Zoom on people's smartphones, we had to get ethical approval to change our methods. I'm not sure what it is like in the countries or the institutions that you're in, But in Australia, that's what we have to do every time we make a significant modification to a research protocol. So of course we made sure we did that before we went ahead with the virtual ethnographies. There's also privacy issues when conducting fieldwork in shared household spaces that many people are still living in lockdown. You have to consider that. When you're talking to people, you may not be able to see who else is in the room when it's an online approach. So you need to think about those issues, particularly if it's a sensitive topic that you're talking to people about, and have they got a safe space in their home to be able to talk, in a private space to talk about those issues. Digital data privacy issues, the sorts of platforms that you are using obviously generate data that may be open to third-party use and commercial exploitation. So you need to think about that as well when deciding what platforms or apps you might be using. And I've mentioned the revised ethics application there at the bottom. And finally, I just have some links here to, or not links, but a list here of books on innovative and creative methods that I've found quite inspiring. I'm happy to share these slides with everyone, and you'll have the recorded seminar as well, I guess, to work from. But if you like, I can share the slides later, and you can have these slides and you can have the links and you can have these lists that you can access later. So thank you very much.
Thank you, Dr. Lipton. Okay, so I think we're going to do questions for everyone at the end. And next, shall we, Dr. Thayer, shall we move ahead with our next speaker? Great. Well, it's my pleasure to introduce Dr. Zanita Marie Thayer, whose wonderful screen share popped away my notes. See. She's the assistant professor of anthropology at Dartmouth College, and she also leads the integrative doctorate program in ecology, evolution, ecosystems, and society. She's a biological anthropologist interested in contributing toward public understanding of how biological mechanisms, evolutionary origins, and developmental plasticity shape patterns of contemporary human health. Her research focuses on the social construction of race and how poverty, racism, and historical trauma create health inequities. Dr. Thayer has worked with populations in New Zealand and the US, and her recent research is driven by a general interest in understanding how maternal stress in the perinatal period impacts offspring's long-term health and well-being. This year, she launched the COVID-19 and Reproductive Effects Study with Dr. Teresa Gildner to learn how the pandemic is affecting women's well-being and healthcare experiences during pregnancy, labor, and delivery. Their analysis of intergenerational stress related to the pandemic aims to generate policy based on the findings. Thank you for being here, Dr. Thayer.
Thank you for having me. So hi, everybody. I'm a biological anthropologist, so slightly different flavor than the awesome talk we just heard. And I'll be talking to you a little bit about how I responded to the COVID pandemic. So as you kind of heard a little bit in that introduction, my research is really interested in trying to understand how and why our environment, particularly early life environments, including the prenatal environment, how that can influence human biology and health. And so a lot of my research has been really focused on trying to understand the impacts of factors such as poverty and discrimination and historical trauma on individual health and offspring health. And so that's kind of the background that I'm bringing to this. So prior to the pandemic, I was in Aotearoa, New Zealand, doing fieldwork. So I was working on a couple of things. One was some research on a series of articles related to the Growing Up in New Zealand study, which is a large birth cohort study that started in 2010 with 6,800 pregnant women. And we're following the kids as they grow and develop to try to understand how early environments influence health. And so I've been working on a series of articles looking at how experiences of racial discrimination impact things like birth outcomes, and telomere length, which is an indicator of cellular aging in children. And I was also in New Zealand trying to start a new project, working with some Indigenous midwives to try to understand how, it's part of a larger project to understand how fear of childbirth and basically sources of support, how all of these things can affect the actual physiological progression of labor and pain experienced in labor. So I was in New Zealand doing that, and then of course COVID happened. And so in New Zealand, similar to Australia, it feels like it was fine, and all of a sudden things shut down quickly. And so made the decision to come back to the US with my husband and our toddler, just because our worst case scenario was being stuck in a COVID hotel for 2 weeks with a toddler. It just sounded horrible. So, in that time, getting back here, everything shut down, stuck at home, working with a kid, I wanted to just hunker down, but I think I felt a calling because I just kept reading these news stories and, being really concerned, thinking about the extent to which the pandemic was likely impacting pregnant women and their families. So thinking about the extent to which stories about people having to labor alone, having babies separated from them at birth until they get a negative COVID test, or if they get a positive test, babies being taken away from them. All of these factors made me really concerned about, women's emotional well-being, and then thinking about how that could be impacting, of course, both their physical and mental health, but also the physical and mental health of their kids. And so together with my postdoc, Teresa Gildner, we launched the COVID-19 and reproductive effects care study to try to understand, the extent to which the pandemic was basically affecting women's maternity care preferences and how that could be influencing their, as well as how their more other aspects of their environment and experiences were impacted by the pandemic, and how that could be affecting mental health and ultimately both maternal and child well-being. So the first thing we wondered was, well, how do we collect data? So normally, in these sorts of studies, I would be recruiting participants in person, going to prenatal clinics, because face-to-face, as I'll get to in a couple points actually, is the best way to really try and recruit people, particularly if you're trying to work with any sort of socially disadvantaged sort of populations. Having that face-to-face meeting is really important, so you can tell people about your, intentions for the study. So ideally it would be in person. Ideally we'd be collecting some sort of biomarkers, so collecting spit from women, for example, to be able to look at stress hormones. We knew that was going to be obviously difficult in this setting. And so what we did was we ended up generating an online convenience sample. So we created a survey through REDCap, which, as was just mentioned in the last presentation, it's important to understand data safety concerns. So we used REDCap, which is a survey platform which is really secure, and it's been set up actually to facilitate data, like medical data collection. So it's HIPAA compliant. So it's very good from that respect. So we set up an online survey, and then we try to figure out, well, what is our population of interest? Do we want to focus on American women? Do we want to focus on international? Do we want to focus on pregnant women or women who have already given birth as well before our survey has started? And so what we had to consider what we were trying to weigh up were a couple of things. One, if we're doing America versus international, how meaningfully are we going to be able to compare women from different places? Understanding that the cultural contexts are very different. We were also had concerns about IRB ethics approval, and whether having international participants, like what that would do to the IRB process, because we were trying to get the study done and out as quickly as possible. So we ended up focusing on a sample of American women, and then we focused specifically on women who are still pregnant for the first survey wave, just because we really wanted to make sure that we had a longitudinal study design. So we would survey women in pregnancy and again postpartum, because we didn't want anyone who's already postpartum for them to have, recall bias and a skewed perspective of their prenatal care experience based on their birth experience. And to move this because I can't see. And so a question we also were grappled with a lot that I alluded to already was, we're really concerned with how to reach traditionally difficult to access populations. So we know from other survey research that it's mostly educated white women that fill out these kinds of surveys, right? Probably for a lot of reasons. And so we tried very hard to leverage, so we distributed the survey via social media, and then also through contacts we had in maternal and child health across the country. And so we tried very hard to distribute it to contacts that were in, all different parts of the country, that were serving lots of different populations, just to try to be able to reach as broad of a participant population as possible. So we're very intentional about that. So what sort of data did we end up collecting? I guess this is just so you know. So we collected demographic information. We asked a series of questions about COVID-19 related pregnancy worries. So whether women were concerned about if they became sick with the virus, if it would affect their baby, if it would have long-term effects on their baby. And I guess perhaps unsurprisingly, a lot of women were very concerned about that. We screened for maternal depression. We asked about impacts of the pandemic on various things, including exercise, how long women plan to work in pregnancy, and then also a lot of questions about patient-provider relationship and communication, as well as fear of upcoming birth. And then postnatal, we collected birth outcome information, again, information on depression, postpartum support, because we thought that the pandemic could be affecting women's access to support if, for example, lockdowns mean that your mother or your mother-in-law can no longer come and help you in that postpartum period. More questions about COVID-19 related fears and worries, and then also some questions about future maternity care preferences, because there were a lot of, again, anecdotal stories coming out about women switching from hospitals to out-of-hospital delivery options because of fear of the pandemic. And so we were interested in trying to understand whether this pandemic may have impacts on maternity care preferences post-pandemic as well. So long story short, we got a lot of data. We launched the survey, and within 4 days, we had like 2,500 responses. So apparently a pandemic is a great time to launch an online survey, maybe early in the pandemic before people were super fatigued. So when we got all this data right away, I felt a need to do something with it. And what we wanted to do was to try to prioritize analyses that we thought would be of the greatest public health relevance, since that was kind of what the motivator was to get going in the first place. And so as an example of that, the first analysis we did was related to patient-provider communication. And so one of the things that we asked our participants about was whether their provider had spoken to them about how the pandemic was going to affect their prenatal care, labor, and delivery experience. So the survey launched on April 15th. So we'd been in full-on pandemic mode for 3 weeks, in the US. And what was really surprising was that 40% of the women said that their provider had not talked to them about how the pandemic would affect their care, despite the fact that something like 90% of these women were very concerned about how the pandemic was going to be affecting their care. And what's more, 25% of women in their 3rd trimester of pregnancy, right? So they're meeting with their provider very frequently. And they said that their provider had not spoken to them about the impacts of the pandemic on care. We also found significant differences according to participant income and education. So women who had lower income and who were less educated were significantly more likely to say that their provider had not spoken to them about the impacts of the pandemic on their care. So why is this important? Well, provider information sharing is a significant predictor of things like satisfaction with provider, and indeed in our analysis it was. So women who said that their provider had not shared information also rated their provider significantly lower. And all of these variables together are really important predictors of perinatal outcomes. And so women who have more satisfaction with providers are less likely to have interventions in pregnancy, less likely to experience poor mental health. And so, optimizing these outcomes is really essential. So this is an example of a type of analysis we try to prioritize. We also we asked women about what questions they had that they felt that their provider hadn't answered, that they were still unclear about. And so from that information, we generated this handout that we then blasted to social media and contacts again, basically summarizing a bunch of the questions women had. So hospital-specific policy concerns, questions around perinatal care, questions around labor protocol or delivery protocol, and recovery protocols. And so when we shared this, we basically said that we wanted people to be able, providers and patients, to be able to use this as a guide of like things that you might not think to ask that, you might actually want to know the answer to. So basically we're trying to make sure that all of the analyses we do, that we had some sort of, academic provider facing side, but then also kind of a public facing side as well, to get this information out. I also wrote up a op-ed in Sapiens, the Wintergren anthropology blog, kind of summarizing some of these results, again, trying to get it to another audience, talking about some of the issues that pregnant women were experiencing in maternity care during the pandemic. So in terms of what's next, well, we're continuing to, write a lot of papers that we think have kind of policy implications, but we're also thinking about now, in the future, starting to address more questions of broader anthropological relevance. So as an example, one of the papers we're submitting is related to something I mentioned earlier about how has the pandemic potentially affecting future maternity care preferences. And so in a way, this also has policy implications because we're finding within our sample, even women who didn't change to out-of-hospital births in this pregnancy, many of them have expressed a desire for exploring those options in future births because, in some instances, they weren't even aware that those were options previously, and now they are because of the pandemic, or they were very unhappy with their experience, and so now they're seeking these options more. In the US, out-of-hospital birthing options are very constrained, and people's access to them are constrained, both financially, in terms of insurance access and reimbursement, as well as structurally in terms of geographic access, because there aren't, for example, a lot of freestanding birth centers in many states at all, due to a lot of legal restrictions. And so we're actually working on a policy brief this term, also to accompany this analysis to try and make the case that we need to be able to, anticipating that there's an increased future need for this, that we need to make some policy changes to facilitate access. Oops, I know that happened. And then we're also working on a grant right now to try and collect and actually be able to look at some biomarkers via the mail, and so, as we just heard about. So previously, when I've looked at things like cortisol, which is a stress hormone, I've used salivary samples. We can get salivary samples and get participants to ship them, but in terms of participant burden, it's a lot higher insofar as I have to ask participants, new moms, to collect spit from themselves and their babies multiple times a day across several days, and then put them in the freezer, and then get them out of the freezer and put them in freezer packs, and then go to the FedEx right away and ship them. And I don't think that's very feasible and is not going to ensure a large sample, and will definitely really skew our sample. And so what we're going to be doing instead is looking at hair cortisol. So we're going to have our participants cut a little hair from themselves, just a little bit, and their children, and they can, which also can have some cultural issues, of course, but hopefully still easier access for the majority. And with hair, it's very stable. You put it in some tinfoil and in a Ziploc bag and mail it in until we can process it. And so that's our kind of creative solution to be able to do this remotely. And finally, one of the other things we've asked our participants about in our surveys are about other non-pandemic related stressors, because of course 2020 has not only been the year of COVID, it's also been the year of a lot of other, social unrest. And so we're interested in talking to our participants. We have talked to our participants about how a lot of other things that have been going on this year are impacting them. So some limitations of the study include the fact that we weren't able to collect any biomarkers in that initial study wave. And despite our great efforts, we have a really white, highly educated sample. And I've talked to a lot of other colleagues and who did similar studies, and they have the same issues. So I see I'm just about out of time. I'll skip this. So I guess one thing I'll say that's been positive about this COVID study is that I've been able to engage undergraduates in this research from a much earlier stage and throughout than I typically would in fieldwork. It's certainly possible to bring an undergrad to the field with me, but not 5 of them all at once without a lot more planning. And so it's been a lot easier to integrate them into the research than this whole research experience than I think it would have been otherwise. So that's been one silver lining. So thank you all very much.
Thank you so much. Thank you. I'm sure we all want to learn more about that. So without further ado, we can open the floor up to questions, Q&A. Feel free to unmute yourself and ask a question, or you can type it into the chat and I'll read it out. If we have a barrage of questions, then maybe just raise a hand and I can moderate. So if someone wants to go first, go ahead.
I'll go, if you don't mind. Hi.
Yes.
Yeah, I'm a first-year grad student in anthropology at SF State. So thank you so much for your time, especially due to the pandemic. And so my question is directed towards Professor Deborah. And I was wondering, how do you choose which data to analyze, and how do you reconcile with the algorithm that controls the data that gets presented to you? So for example, when you're on like YouTube and you're looking at these videos, there are algorithms that control what kind of videos you see based on your background, age, demographic. And I was just wondering, how do you address that?
Well, as I mentioned in my talk, I actually don't do a lot of digital analysis of those kinds of, I don't do a lot of data scraping from digital, already born digital content. So that's not a question I can really answer. I'm afraid it's not really in my area of expertise. But I mean, it's a good point to raise. I mean, it's like Google search. Google search is customized based on every search that you yourself put in. So whenever you search for something, it is responding to your previous searches. So there's no doubt about that. But the data that I work with are pretty traditional interview data and focus group data and the artifacts that are generated when people do those sort of creative methods works with me. So fortunately, I avoid that problem.
Thank you.
Okay, so Sunanda, you had a question? Go ahead.
Hello, my question is for Dr. Thayer. And I was wondering if you saw any differences in the responses that you received depending on the type of hospitals that the women went to. Specifically, I'm interested in baby-friendly hospitals or hospitals that focus more on breastfeeding in favor of women's overall health. And especially now with all of the hospital restrictions, such as not allowing a visitor or having babies taken away. And I am aware that in general, baby-friendly hospitals sometimes don't provide formula. So I am wondering if baby-friendly hospitals versus other types of hospitals, or even underfunded hospitals, the women had different, like higher levels of stress, depression post birth.
Yes, that's a great question. Thank you for that. So in our analyses, and actually in terms of the data we collected, we didn't differentiate between baby-friendly and non-baby-friendly hospitals. Instead, we asked about whether people gave birth in a hospital, at a hospital-based birthing center, at a freestanding birthing center, or at home, because we were really interested in the comparison between hospital versus out-of-hospital births, because those are kind of where, you know, based on the literature, we feel like the philosophical approaches to birth are the most disparate. And I completely agree with you that there is a lot of heterogeneity in the category of hospitals, right? I think an interesting thing that happened in the pandemic was that, you know, a lot of times women living in a city, for example, choose a hospital based on what's closest to them, right? Or what they know. It's not like they necessarily, or it could be because of other certain factors. But once the pandemic hit, since there was no consistency in terms of how hospitals responded. So all of a sudden, a woman, the hospital she's at might be not allowing any visitors, or might be saying if a visitor comes, they can't leave, or everyone has to wear masks, or all sorts of things. But then the hospital just down the road that they almost went to, but didn't, just because this one was a half mile closer, isn't having those restrictions. And so there was a lot of anxiety and stress around around this inconsistent application of rules. And I don't know if that application of rules corresponded to baby-friendly versus not. That would be an interesting thing to try and understand. But unfortunately, I don't have the data to do that.
You could retroactively, like, maybe ask people which hospital they gave birth, and then apply that, like, as another maybe variable.
Yeah.
So there was a question in the chat for you, Dr. Thayer, as well, just about if you've come to any conclusions yet about mental health amongst this new study group.
Yeah, so unfortunately, in our sample, as well as others that are starting to be published, the rates of stress and depression and anxiety are incredibly high. So within our sample, I used a really conservative cut point. So I used the Edinburgh Depression Survey, which is the one that's the most appropriate for pregnancy and postpartum. And there are different cut points depending on whether you're talking about postpartum or pregnancy. So I made sure to use the more conservative cut point that's supposed to be used for pregnancy, even though a lot of people don't, because you get more depression numbers the other way. But even so, with our conservative cut point, something like, I can tell 35% of our sample had clinically significant depression symptoms, which is, twice as high as it should be. There's unfortunately a lot of evidence for depression. And so we've done a lot of studies trying to understand factors that predict depression in the sample. So one of the papers we just published was COVID-19 related financial stress, perhaps unsurprisingly, but women who reported experiencing financial stress because of the pandemic had significantly higher depression, more than 2 times the odds. And that was independent of baseline income. So, even women with higher household income, those who said that their finances were affected by the pandemic, they also were more likely to experience depression. We've also looked at exercise and impacts of the shutdown and shelter-in-place orders on women's exercise patterns. And so we found that women who said that the pandemic had affected their exercise more were significantly more likely to have depression, and they were also more likely to live in urban areas. And so that related to the fact that a lot of the urban participants were more likely to go to the gym, or normally the gym that then shut down, and they were more afraid to go outside, for example, and exercise on the sidewalk because there's a lot of people. And finally, another analysis we did looked at impacts of work plan changes on depression. So women who said that the pandemic had affected how long they were planning to work in pregnancy or when they were planning to go back, but in particular women who said that the pandemic was going to affect their plans, but they were unsure how they were going to be affected, were more likely to have depression. And so that reflects, I think, a lot of financial insecurity, right? And the fact that some women are still working outside the home as essential workers, so they're worried about infection, but they can't stop working, or they're trying to figure out if they can stop working and still be able to afford it.
Unmute.
So yes, Cindy has her hand raised.
Hi, yeah. Dr. Thayer, I've enjoyed both of your things that you have had to say. I was just curious if your data has shown any significant change in the production of breast milk, if the stress of COVID has, I would assume, would decrease it, but I wonder if you have any data on that.
Great question. So we have questions on breastfeeding behavior, but we didn't actually collect any information about, volume, for example. I do have human biology colleagues, however, who did that study. Actually, they were looking at women who had COVID and trying to understand whether it affected breast milk volume. So Dr. Melanie Martin at University of Washington, if you look up her, she might have some preliminary data out. And then separately, another colleague, Dr. Elizabeth Quinn at Washington University, she also has a COVID lactation study running. So they're my lactation friends that are, have more data, but we do have some, I just haven't looked at it yet. But great question.
Dr. Wilczak?
Yes. Yeah, this is for Dr. Lipton. I'm just wondering, one of the things we've been dealing out with at our university is just the psychological stress for researchers, particularly those who are early stage, say graduate students, assistant professors. You're very established in your career, but I think the impact of the loss of time due to the pandemic has really increase those stress levels. And I'm wondering if you have the same concerns at your university?
Oh, okay. Yeah, definitely. So we actually have the added stresses, and I know that's also the case in the US and many other countries, in that we're just now suffering massive job losses. That's actually top of mind, I think, probably at the moment for early career researchers, because they're the first ones to go, unfortunately. They're the casual staff, the precariat, as we call them. And they have not had their contracts renewed. And now we've gone through a whole lot of redundancies for permanent staff. So it's actually, the stress levels are high for everyone. But yeah, as you say, people like me are very privileged and our jobs are safe. What I've been doing so I do have my little team of postdocs. What I've been doing to deal with that is, basically I said at the very beginning of COVID, when it became obvious that it really was going to be, the pandemic of 100 years, I said to my postdocs, you now have to turn your research to COVID, because it's going to affect everything in everyone's lives, every aspect of everyone's lives. And so we very quickly oriented our research, all of us, to doing COVID-related research. The fieldwork I was already doing with one of my postdocs that I talked about originally, the home visits, of course, suddenly became what it was like to use digital technologies during COVID restrictions, because that's what the life that people were living there. And we're about to have a paper published out of some of our early findings. So in a special issue on digital technologies and media and COVID. So I talked to them, and I would talk to, and also to doctoral students, the same sort of thing. We are all now COVID researchers, whether we like it or not, because we are all now living in a COVID world, and so are the people that we are going to be working with. And as social researchers, we are highly oriented to the social differences, the cultural differences, the geographical differences that, you know, exist even within our own countries, but obviously anywhere else we might be doing field work. I mean, in Australia, we've had border closures between our states for the first time in 100 years, basically since the Spanish flu pandemic, for example, which has raised a whole lot of interesting politics, internal politics about, you know, us versus them, you know, the Victorians versus the New South Welsh people, the Queenslanders versus the Western Australians. Really interesting. And I'm sure that's happened, and I know that's happened in the USA as well, even between towns and different towns in the same state. So yes, basically, yes, there's a lot of stress. I'm trying to deal with it by being a rainmaker. I'm applying for lots of grants that have built-in postdoc funding, you know, to work with me. That's how I'm dealing with it as an established researcher. And basically, it's advising the early career researchers working with me that, yeah, now's the time, you know, forget what you were doing before. It's COVID now. Let's really focus on how we can contribute to social research on COVID.
So there's a question in the chat about that directly, how your postdoc team is responding to pivoting their research.
Well, they responded really well. It was an interesting team. I've got 3 of them at the moment. I'm about to actually recruit 2 more for the new Centre of Excellence in Automated Decision-Making Society that we've got funding for 7 years for, which is great. So new jobs already created there. So they'll be joining the team. And I run the health focus area of that new centre. So I will, again, obviously be, I mean, COVID-related apps and contact tracing apps, you know, epidemiological surveillance, online methods are suddenly becoming incredibly important. You know, wearable technologies to enforce quarantine are being talked about at the moment in Australia. I'm not sure if they're being talked about in the US. So many of the ways forward will involve using digital technologies safely, effectively, and ethically to control COVID outbreaks, so that we can all live a slightly more normal life in the future. So yeah, my postdocs responded really well. They'd already doing work on digital technologies. There was one who's done a lot of work on embodiment and health and fitness, and she's looking at how people are engaging in exercise at home using online platforms and so on. So no, they've really responded well. They're really enjoying it. I think they're excited by the opportunities. We're actually, the 4 of us together are writing a book on the face mask in the age of COVID from a socio-material analysis perspective. So we're all working on that right now. So yes, we're all very excited about it.
Wow, we will keep an eye out for that and distribute it when it gets time. So another question from the chat, to all the seasoned researchers here, what advice would you give to students who are adapting to doing fieldwork during the pandemic and maybe doing fieldwork for the first time?
Yeah, I would say, so I have a graduate student who was just finished her first year, so she's starting her second. And we developed this awesome PhD project to go to some far-flung, well, probably Nepal stuff somewhere. She's really interested in how consumption of non-human milk, so other animals' milk, how that affects our growth and development in light of the fact that, you know, our milk has evolved to have a very particular, you know, things that our babies need, just like baby cow's milk has evolved to have certain things that they need. So how does drinking baby cow's milk affect us? And then how do different cultures that have fermented milk products in different ways, how does that affect how it affects us? Vis-a-vis like impacts on the microbiome and growth and inflammation. So anyways, we're developing this project for her to go somewhere in Nepal where they're eating lots of different mammal milks and fermenting them different ways. But we don't know if that's going to happen with COVID, right? Even if we get a vaccine this year, ethically, it seems like it would be extremely unethical and irresponsible for us to go anywhere in the coming years where participants might not have access to a vaccine yet, and if anybody gets it, like there's not good infrastructure. I don't know, I think we're in this for a while. And so with her, we've been kind of trying to develop like a parallel local project. So we're in Vermont, there's lots of dairying here. So, you know, we're thinking that if she can't go to the field, then she can still go to the field here, hopefully, and, you know, find some local moms who will let us give their babies some raw milk from a local farm and collect their poop. And so it's not, I think the advice I would give is to try and have parallel complementary plans or something, you know, like a plan A and a plan B, where obviously, hopefully the theoretical and even the theoretical ideas are the same. The methods to an extent are similar. So you're still getting all that experience, but maybe the population you're working on, you know, you need to be flexible.
I think that's really great advice. And I think, frankly, I think a lot of people are still in denial about this pandemic. I think, you know, people are still talking about getting back to a new normal. It's just getting worse, you know. I mean, in most countries it's getting worse, including the USA. You know, India, it's now completely getting out of control, for example. I mean, it's not in control in most countries, and we've only just about to stamp out a second outbreak in Melbourne, in Victoria, the state of Victoria, and people have been in lockdown for months to deal with that. So we saw it here where we thought we'd managed things really well, then boom, just because of a break in international containment of travellers, expats coming home, and quarantine, boom, you know, second wave. I think as academic researchers, as teachers, as people supervising doctoral students and postdocs, you know, we really do, I think we all need to just come to that realisation that things aren't going to change, the situation is going to change anytime soon. International travel is not going to be available or safe anytime soon. You know, we're currently not allowed out of the country in Australia and haven't been since March, and I don't know when we will be, actually, because that's been one of the key ways of controlling the virus in our country, is closing international borders. You know, our Qantas has gone bust, you know, our international carrier, basically they've gone, you know, completely bust, and they're saying they don't know when they'll be able to start up again. So all that is to say that, yeah, I think we just have to really face facts and including our students, and yes, be flexible and think about ways to do things close to where we already are, as has just been suggested, or you know, or think about doing it in some way virtually. You know, there's two options really, but involving, you know, research involving a lot of travel outside a safe area, and particularly international travel, I think is going to be incredibly difficult for a long time.
Yeah, and I'll just add the virtual thing. I had some students a student who was supposed to be in Japan this summer, and so she ended up doing all of her interviews on Zoom. So not quite the same, but, you know, it is still possible.
Lauren, would you like to ask your question now?
Yeah, so this is a question for Dr. Thayer. It might be a little bit outside of your area of study, but I was curious if you know of, I guess, any other research being done currently about neonatal socialization. For instance, like baby classes and just in general, that's obviously not happening right now. So I guess, how is that process of like integrating newborns into our very social world? Like, how is that working out? Do you know of any kind of research that's happening concerning that?
I don't know of any research concerning that, and I've thought about that a lot. Like, I've thought about trying to hypothesize what developmental stage we think will be most sensitive to this loss of socialization, right? So is it newborns? Is it toddlers? Is it, you know, 3 or 4-year-olds? Is it high schoolers, right? I think you can make a case that a lack of socialization has adverse impacts across development, because at the end of the day, we're incredibly social creatures. Like, that is what we have evolved to do. So that's what I think is one of the really cruel aspects of this virus, is that it's really, starved people for social interaction. So in short, I don't know the answer to that, but that is a great question.
Okay, we have a question in the chat. Let's see, Dr. Lupton, curious about the creative writing methods that you mentioned. Could you speak more about that? What were they used for? Do you use them as a substitute for interviews? And how are they different from interviews, if so?
Yeah, so they're not used as a substitute, they're used as a prompt or a stimulus for interviews or group discussions, actually. So I did flash up a quick image showing two activities from a workshop that our lab held in person last year, in fact, almost exactly a year ago in Sydney. And we had prompts where we asked, people were sitting in groups, small groups in a large room, but working individually on the creative prompts. And then once we had finished them, people were invited to share with the group. There was probably, I guess, about 25 people in the room, as together in total, and in small groups, they were around tables, and they were invited to share with the larger group how they found the activity, what kind of thoughts and feelings. I'm always really interested in people's effective responses to things, so I'm always really keen. I think creative writing or other creative, zine making, for example, or mapping, those kinds of things can really generate those feelings and often unarticulated responses to the phenomena in question in ways that just directly asking people about don't always manage to do. So we engage in these activities, and then we have a discussion. It might be in one-on-one interview setting when we talk to a person about the artifact they created, or it might be in a group setting where we talk as a group. And obviously it's up to people how much in a group setting they want to share about what they actually wrote, but they can also talk about, I don't know, the thoughts and feelings that the actual experience of generating the artifact evoked for them. And so one of the examples that I showed in the slide was what I call data condo. And I got that idea through when Marie Kondo's work on, what sparks joy, because there was a Netflix series, that came out, and everyone got suddenly interested in condoism and what sparks joy in things in people's lives. And I was really fascinated by that because, of course, there's that kind of interesting Japanese cultural approach to things that we often, as Westerners, don't share. And in the Netflix program, she was engaging with Westerners. I think it was all Americans, actually. And, she would say things about the kind of spiritual or affective feelings that people have about their stuff. And a lot of people, Westerners, are going, what is she talking about? This is weird, kind of thanking an object, But it's very much part of a Shintoist approach to things. But for Westerners, it comes across as quite strange. But when we think more carefully about it, we actually do have very strong affective feelings and responses to things, which makes it so hard to get rid of stuff, doesn't it? Which is what she was trying to kind of deal with these people who wanted to get rid of their clutter. So I thought to myself, I'm interested in how people use their personal digital data, how they store their own data, in archives, their photos, for example. We've all got so many digital photos now. How do you deal with those? How do you get rid of them? Do you ever look at them? So the data condo creative exercise was about asking people what sparks joy for you around your digital data, and to think of your digital data as things that have often very emotional resonance for you. When you think about your archive of personal photos, for example, they're often incredibly emotionally resonant for people, and it can be hard for people to get rid of them and to go sort through them, for example. So that's what that was about. And then we got people to engage with that, what sparks joy for you, what will you be happy to get rid of in terms of your data, what wouldn't you and why? And then we had a group discussion about it. So that's how that worked. I have published with my postdoc Ash Watson, I have recently published an article in qualitative research, the journal Qualitative Research, that talks about some of these methods. We call them research hyphen creation methods, and we use new materialism theory to talk about how we theorize the artifacts and the discussions, if you're interested. So maybe chase that up.
Yes, and we'll distribute links to both of your many resources and papers and blogs afterwards, along with this recording, so we can all keep up. Next, we have a question from Dr. Lincoln. Thank you.
2 questions, if that's okay, but both pretty quick. I want to say thank you to both presenters for their wonderful sharing. It was a pleasure to hear from both of you. And I want to ask one question that I think broadly might be answered by either of you about sort of a philosophical question about self-quantification and self-tracking, which Dr. Lupton has critiqued so insightfully in her research, and how or whether we might think about research as indeed a kind of form of self-quantification that we're asking our participants to participate in, and whether there are deeper or more subtle issues that we bring into research along those lines. So for example, Dr. Lupton, with your question about sparking joy with digital storage systems, I'm particularly curious to hear you suggest how that question might be distinguished from the kind of question that like an industry anthropologist might ask, because it does seem like there's so much richness there, but how would you, from your critical perspective, be steering that, that research trajectory? The second question is specifically about the ethics of using digital platforms, which we're only now, I think in the last maybe 5 years, starting to understand more about in terms of the kinds of ethical and political agendas that are ported in, including by platforms that often seem very neutral and unoffensive. So I don't know if either of you is aware, but we recently had an issue on this campus with Zoom hosting an open classroom event given by a Palestinian woman who has been accused of association with a group that is considered to be a terrorist organization by some critics. And Zoom actually not only rescinded the permission to host that talk, but threatened the entire CSU with the removal of our Zoom license. So it seems like as we increasingly spend time on these digital platforms and they become the new medium for sociality, there are new kinds of political questions that we're being forced into without a lot of choice and often without a lot of information. So I wonder what your thoughts might be about those 2 things.
Yeah, well, they're 2 huge issues. We could have a whole seminar about each one of them. Thank you, yeah, really important question. So to get to the sort of issue of, I guess, documenting people using research, you're absolutely right. Yeah, I mean, any kind of research, whether it's scientific or social, if it's applied to human subjects, is a way of documenting them and monitoring and measuring them in some cases, but at least documenting in some way. And there is I'm sure you're aware, there's a very rich tradition in qualitative research of critiquing that and raising, reflexivity questions about the ethics of conducting research with people, which does often and can evoke very sensitive issues, ask them to talk about their emotional issues. For me, that's more the ethical issue than really the fact you're documenting them in some way. But I guess any social research has to document humans in some way, doesn't it? I mean, that's what it does. So I think to be very, very upfront and careful about how you're going about that. And I guess that's what ethics approval in some ways, forces us to do, although that's often a risk-aversive process in terms of the university's point of view. But I think as researchers, when we're having to do our ethics approval applications, I think that also gets us to think about those things. And yes, there's a massive responsibility there for any researcher whenever you're conducting research with people in terms of behaving ethically, and thinking very carefully about what you're asking people to do. One thing I make sure of is when I'm recording, you know, obviously when we're doing video recordings of people, we have a very lengthy part of our ethics approval where they have to, you know, their consent forms, they have to agree or not, you know, show that they don't agree to how we're going to use that visual material, whether they're happy for us to use them, use, you know, grabs from the videos in presentations, for example, versus publications for open, you know, for readership. So we make sure we check all that out. You know, there's ways of anonymizing people's faces or just showing their hands, for example, that we often just do anyway, which completely kind of makes sure that they're anonymous. So there's all sorts of ways and all sorts of things we do need to think about absolutely there. Because yes, we are documenting aspects of people's lives. When it comes to digital platforms, you know, I have written quite a lot about data privacy and personal data privacy and security issues. And it's always a question I ask in any research project dealing with people's experiences of using digital technologies. There's always a question towards the end, do you ever worry about where your personal data go, who's using those data, you know, beyond myself, because we've already had that discussion in the ethics and the consent, but, you know, third parties, how the platform itself is using your data. What I find is Australians don't know and don't care. Basically, they don't really care how people might, how, you know, platforms like Facebook, for example, or Google might be using their data. I did an interesting project that I called the Data Personas Project, where I asked people to think about data profiling. And I called this concept of the data persona, you know, the kind of profile of you that's generated by all your engagements online when you go online or use apps. And I asked people, you know, how similar or different do you think these data personas are from you? You know, how do you think they're used? And it's actually really interesting because people did say, well, it's only a partial version of me. It doesn't know my real thoughts and feelings. It doesn't know my biography. It doesn't know my spirituality. It doesn't know my family tree. It knows my, you know, data personas, data profiling, you know, they know my name. They probably know where I live. They know I have children or not, and that sort of thing, but they don't know the real me. So I thought that was really interesting because I think that's actually, although we hear a lot of, you know, techno dystopian, you know, representations of platforms like Facebook, for example, we only have to, if we're Facebook users, know the very kind of broad kind of targeted advertising they use, which is supposedly incredibly manipulative and makes us all go off and buy stuff we don't want. But we as users of Facebook know how often wrong it is, you know. We get weird advertisements. We say, that's not me, you know, why are they giving me this ad? And, you know, there's been a lot of research to show that people think Facebook doesn't know them well enough. Not that they know them too much, because they send them these ridiculous ads that they think, that Facebook seems to think will, you know, entice us into buying something. So I think it's a lot more complex than we often hear in terms of third-party use. That's not to, you know, I think the whole kind of Cambridge Analytica scandal was way overblown because Cambridge Analytica made a lot of assertions about how they could manipulate people using their psychographic profiling. Well, that was just them trying to sell their product, you know. I think that was completely overblown. But anyway, so yes, and there are data leakages, there are data breaches, there are data hacking, there is a lot of cyber criminal activity going on, stealing people's identities and, you know, defrauding insurance companies and so on, no doubt about that. But in Australia, at least, most people aren't affected by that. They haven't had it happen to them as far as they're aware. So there's a bit of a, you know, I would sort of say there's a lot of grey area in terms of issues around, we should all be aware of data privacy and security, and as researchers we should absolutely should be, and I did mention that in my talk. We need to think about how the platforms that we're using for virtual ethnographies, for example, you know, how they are using the data that we are generating together with our participants, absolutely. But so is that something we could consider, and we should let our participants know about, and they should consider as well. But on the other hand, you know, we do need, in many cases, to use some kind of platform. We're using one right now to do this. So let's be alert, but not kind of too techno-dystopian about it. Because there are many benefits, as we can see right now, in what we're doing right now.
Very true. And in being mindful of everyone's time, we had said we were going to wrap up in about an hour and a half. So we're approaching that time. Unfortunately, we'll have to pause this conversation. Hopefully, we will be having another webinar later in the semester. And I just had a thought that we could go with a hashtag ASA Fieldwork and continue the conversation in some way, either through our Instagram, something like that. We'll send out information to the original list of people who received the flyer with lots of links so we can follow up on Dr. Lipton and Dr. Thayer's work. And please, I imagine you would like to receive everyone's additional questions, hopefully. So thank you so much to everyone in the department, all the students, and especially to our scholars for being here today. This was a very engaging and important conversation. So any other final remarks, Dr. Rafe Schneider?
Yeah, I just want to second Talia's sentiment. Thank you all so much for coming, and thank you for sharing your really important research. And I think we had a really great discussion, and yeah, I look forward to being in touch. So thank you all.
Thanks, everyone. Enjoy your evening.
Yeah.
Enjoy your morning.
Enjoy your day.
Thank you.
Thank you so much. Great to see you all.